Welcome to the Off Leash Podcast with Dr. Pete. I'm your co-host, Molly Van Vranken. We're so glad that you joined us for today's show. Remember, we are never here to say what you want us to say. We're just here to be an advocate for your pet. And I got Dr. Pete sitting across from me.
I am.
On his day off.
On my day off.
From being a veterinarian.
Yeah, I'm a veterinarian every day, though, sweetheart. That's if you were home, you could hear the phone ring every once in a while.
I know.
Yep.
Always on the phone with clients.
Yep.
You ever think about retiring?
I don't know. It's crossed my mind from time to time, but too lazy to do anything about it, I guess. So there you go.
So you're just going to go to work every day?
I go to work every day. You know, the world we live in today, sometimes sitting home and watching CNN or Fox or any of that sort of stuff, it's not very healthy for you, I don't think. So I think what I do is I go in and fix stuff. And so that's healthy for me. It's healthy for who I'm looking at. And so all sorts of challenges in this world today. And we try to deal with the challenges we're capable of doing something about.
Yeah. I get that asked a lot if you're going to ever retire.
Yeah.
And I said, I don't think he's ever going to retire.
Well, I don't know. We'll see what happens.
How old are you?
76. Excuse me.
And you've been a vet for
51 years.
Holy cow.
It's a long time.
Long time.
A lot of good stories. I used to go to cocktail parties and tell all the stories, and I got tired of doing that. And I mean, they were good stories, and they were kind of fun. And your mother, tells some of them sometimes. The ones that she thinks
I
are
still
funny.
hear some from her.
No, I know.
About your farm call days.
Yeah, farm call days, yeah.
Where you were apparently quite the eligible bachelor.
Well, yeah, I don't know how eligible I was. Somebody thought I was eligible, and that may have been the wrong summation on their part. So,
but today we're still going to be a vet, and we're still going to talk about an interesting topic of nutraceuticals.
Yep.
Which I just learned this word
it's stuff you can buy
5 minutes ago.
So stuff you can buy CVS and Walgreens, and it does help some.
So what exactly are nutraceuticals, and how do they differ from traditional supplements or medications for dogs?
Well, traditional medications have to be okayed by the FDA. These are all things that are probably under the supervision of the EPA, Environmental Protection Agency, and not the FDA. The FDA, if you're going to make a claim on something, then you're going to have to prove that it actually works. So we'll talk about some of those. I have a cat today that is kind of battling for his life. He's been obstructed urinary wise for a long time.
Ooh.
Yeah. So
how do you have to poke into their stomach and their bladder and empty it manually?
You put a catheter in, and you leave the catheter and you run IV fluid. So you're running it in the front leg and out the back penis. So you're just what do they say? This creatinine was 13 and now it's 2. So the solution for pollution is dilution. So what we're doing is we ran saline in for a while, and we ran saline because they didn't want to give any potassium because this cat's potassium was sky high, 8.3. So that cat was actually having a hard time making his heart work because the calcium was competing with the potassium. All this stuff is kind of complicated. But I was going to talk about urinary tract stuff. We get these from time to time. And especially in dogs, we sometimes get these UTIs, urinary tract infections.
And you can tell in a female. They happen more in females, right?
They happen all the time in females.
Because they stop pee.
Yeah,
Stop pee.
Guys that are talking about their UTIs have they got a whole different set of problems than the young ladies. But I was going to tell you, one year we were doing, we signed up to do a drug study on ear infections and stuff.
Mm-hmm.
Can't see my ears because the headphones are on. And if you're listening to this, you can't see I have headphones on. But anyway, what happened in these cases was we would take blood work, complete blood cell count, white cells, red cells, chemistry profile, and we're doing a urine analysis. So I pull all these blood samples and I send them in. In the meantime, I start the study. So we go ahead and evaluate the ears and decide they need to have stuff put in them. It's double-blind studies, so some get stuff, some of them don't get stuff. Mm-hmm. If they don't get stuff, then they eventually get taken off the study because it was not effective. But in this case, 2 of these dogs out of 30 or 40 that we did had urinary tract infections, and they were female dogs. Mm-hmm. And so now it's like, well, the sponsor calls and says, we got to take these dogs off the study because they have a urinary tract infection. And I said, we've gone through a lot of work, and you've gone to a lot of work and expense to start this dog on the study. let's do this. I said, let's put this dog on cranberry tablets for a while and see if we can control the urinary tract infection.
You can do that?
Yeah. So let's see if we can control the urinary tract infection with cranberry tablets. And any study has these, what do they call it?
Placebo?
Well, no. Well, there was a placebo. There was a placebo in this study, but things that make you eligible and things that make you ineligible. Mm-hmm. And so the fact that this dog had a urinary tract infection, it didn't say anything about this that would make it ineligible, but they thought they didn't want this dog to have a urinary tract infection for 45 days while the study was going on. So I said, we'll put him on cranberry tablets and then we'll do a UA after 7 days and see if it's better. And we did. Both these dogs got this done, not at the same time, but I think one was like, we're doing the study maybe in August and the other one was in November or something like that. So kind of get the hang of, okay, this is what we're going to do when we get one of these. Mm-hmm. We'll put them on cranberry tablets. So you get the end of the 45-day study, okay? And the one dog doesn't have any urinary tract infection. The other one has just a slight one. So we treat the slight one. The minute they come off the study, they can be on antibiotics. Could not have these dogs on antibiotics and then have these, and then be testing for an ear infection because you got the dog on antibiotics. Mm-hmm. So that was, so the guy or the girl and running the studies like, well, that's clever. You did that, and we saved the dog, and one dog was normal, and the other one was damn near normal. And we got the end of the study, so we could say, well, this is, so I would not have normally done this. I mean, why in the world would I give cranberry tablets when I have access to antibiotics that really work? But, if you had a urinary tract infection on your dog on Friday night and you weren't going to be able to get into Monday or Tuesday the following week, go get yourself some cranberry tablets, put them on. Does it help? Hell yes, it helps. It changes the pH in the urinary tract so the bacteria can no longer live. So it's one of those things that I think people talk about doing this, drinking cranberry juice mm-hmm. when they've had a urinary tract infection. Does it work? Hell yes, it works.
That's impressive.
I didn't know it was a hell yes deal, but it worked.
So are nutraceuticals regulated in the pet industry? Just
by the EPA, but not by the FDA. So what they want to do is they're going to check these cranberry tablets, make sure there's not arsenic or cyanide or lead or anything like that. So that's what they do. They test that.
Okay. So what are the most common reasons that dog owners turn to nutraceuticals? Is it mainly for the UTIs or is it?
Well, it's all sorts of things. So that's what we're going to talk about today.
Yeah.
So you got an arthritic dog. So you had an arthritic dog and you don't want to put them on a non-steroidal anti-inflammatory. Do you have other options? Yeah, sure, you got options. Glucosamine, chondroitin. They have these new ones now. They have hyaluronic acid and eggshell liners in them, boswellia plant. All those things would contribute to taking care of some of the arthritis. Omega-3s, cassiopentoic acid. It's in fish oil capsules. It stops what they call the arachidonic acid cascade, which is a pathway through which inflammation goes.
Okay.
So you can put them on all those things, and for the most part, they'll help. And if it helps and you don't need to medicate the dog at all, then that's fine. Most of these things require cocktails. So most arthritis cases are more like making a Long Island iced tea. So you have to put all sorts of stuff in there.
Okay, so let me ask you this. How can dog owners distinguish between effective nutraceuticals and marketing hype?
Okay, well, if you were going to, and I agree, the marketing hype is nuts. So the way I do it with some of my clients, if the woman comes in with a dog, I'm like, okay, look, you don't want to give carprofen, or you don't want to give Deramax, or you don't want to give Previcox. I got that, okay? So what we're going to do, we're going to play a little game with, and if this only works if you're married, and so, or you're living with somebody. So I tell her, here's what we're going to do. We're going to put them on Movaflex and maybe some omega-3 fatty acids. Okay, so we're going to do this, and we're not going to tell your husband. And then you see what happens. So the woman's already, well, this is going to work. Well, we don't know if it's going to work or not, but she has some anticipation that it will work. The old man has no anticipation that anything's going to work because he doesn't know we're giving it. So then what you have to do, you have to evaluate what this dog does. Oh, it's kind of weird. Our dog's now getting on the bed, or it's now getting on the, it's running around in the yard, not walking around in the yard.
You kind of just have to see what works.
Yeah. You have to see.
Other than making up stuff in your head about like, oh, I feel like I'm doing this and it's making things better.
That's exactly right. Okay. So there's one, arthritis. Okay. We've got an old cat that's having real hard stools. half constipated most of the time or something like that. And then they're trying to figure out what they can do for this cat. So they give it, they're giving it hairball stuff because there's oil in it and stuff. Well, they make they make a cat food now, which is Royal Canin Fiber Response. Whoever invented that did a damn good job. So what you do is you're putting them on this, good for them, because they don't always get it right. But they got this one right, and they got it, it's a right-on deal. In the old days, we have to give them Cisapride, and we had to try to get stuff down them, not Miralax, but, what's the other one?
Some type of stool softener.
Yeah, stool softener, that's right. So you had to do this and do that. Well, they decided they're just going to put a crap house full of fiber in the diet, and that's what they did. And boy, does that work good.
Good.
We haven't done a colonotomy, sorry, where you take the colon out, which is what we had to do, and those were real dicey. One of the guys in our office, Dr. Van Ryswick, did those. He was pretty damn good at it. But, the question is, could you keep the cat alive for the first 2 weeks after doing it? It was a real pain in the ass.
I believe it.
Yeah, but now we have this diet, so we just send that diet home. And the people are like, wow, that fixed our cat. And what happens is they get a little older and stuff they used to do easily, they can't do easily. So they're getting constipated from time to time. When I got a cat right now, the cat that has the urinary tract thing has a bunch of stool in it, probably needs an enema. This cat has other stuff going on. We've got a feeling if I fix what else is going on, this cat may or may not be constipated afterwards. But anyway, yes. And this cat food's kind of expensive, but you know what? It works.
Yeah.
So here's what I tell everybody.
It's expensive.
Yeah. If it works, it's cheap. If it doesn't work, it's expensive. Irregardless. So you could buy something real cheap so you could buy that paste, the hairball stuff and everything, and give that. That hairball stuff's expensive because it doesn't work. And the Cisapride used to work okay a little bit, sometimes not. It's a drug, and if it doesn't work, it's expensive. If it works, it's cheap. But the thing that really works good is the cat food. Royal Canin Fiber Responsive. So if you have a cat that's about half-ass constipated, or hell, for that matter, full-ass constipated,
use that.
And you have to feed it for a couple of weeks, and all of a sudden the clients will tell you, yeah, wow, this is great. Our cat's having regular BMs and everything.
Good.
Yeah, but sometimes you have to use that and Cisapride. I mean, it depends on your patient. So you have to wait and see how it works.
Yeah.
And if it works great, it works great. But it's something that people can do at home just by feeding their animal.
Right.
Feeding their animal is the correct diet with a boatload of psyllium in it. That's
okay.
Yep.
Are there any nutraceuticals that show promise in supporting cognitive health canine cognitive dysfunction?
Yeah. Well, you've seen the Purina does this Bright Minds thing.
Uh-huh.
Okay, so what they're using there is medium chain coconut oils.
Oh.
Yep. And those work really good. And I heard a cute story about this because what happened one time was when they're doing the studies, they're having to figure out whether it's working or not working. I'm sure they were doing it at the Purina laboratory or their kennel and stuff like that.
Yeah.
Cognitive dysfunction, just for the listeners' benefit, is where you're there and you're kind of lost. You lose your house training. You kind of get caught in corners. We had a dog that wandered around bandit. He'd wander around and he'd go to bed, and all of a sudden, you're in bed for 15 or 20 minutes, and now he's wandering around the bedroom and walking, and his sleep cycles are all screwed up. Maybe not recognize you very well. I mean, he was old, so he had, probably limited vision, but he got caught in corners, and then what you do?
Sad.
Well, they had a drug called Seledgely, and it worked okay, but really, I think the thing that worked the best was this medium chain coconut oil. Well, here's what happened. So the people at Purina were running the studies and everything, and of course, they're not kind of supposed to let it out, what they're doing, and top secret sort of stuff and everything. Well, privately, they were all taking medium chain coconut oils because it was doing so much for the dogs. They decided they'd take it themselves. And
wow.
We think it probably helps for people too, but you don't see much written about it. But that's what Bright Minds is. Have you ever seen that ad?
I have. I didn't really know what it was for, though.
Yeah, it's for cognitive dysfunction.
Aww.
Well, you feed this stuff, and then the client calls you back in 3 weeks and goes, he's back. And I know what that means. In other words, he's back on Earth.
Yeah.
He hadn't been on Earth for a while, but now he's back on Earth. knows
Yeah.
what's going on. He's got his.
Oh, that makes me happy.
Yeah. So I mean, and sometimes even though you're on this, eventually this progresses along to where they have to be euthanized because of it. But you can get an extra year or two out of them sometimes just by recognizing what cognitive dysfunction is, and you can look that up. Canine cognitive dysfunction. It describes it, and so clients will read this, and they'll figure it out. And the drug of choice is bright minds.
That's awesome.
Maybe with selegiline, the drug that's supposed to help with that too. And so we've used both of them together a lot frequently.
What about nutraceuticals for managing anxiety or allergies or like skin conditions?
Well, the allergy thing, we talked about the omega-3s. Those help a lot. I seen all these ads on TV, or not on TV, but I guess Instagram. Well, take this pill. You don't have to give Apoquel, blah, 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 blah.
Pete's
blah.
on Instagram now, by the way.
Yeah.
We started him one.
Yes. Tragically, I am. But anyway, so I'm seeing this and I'm thinking like to myself, I'm watching these ads and stuff. Well, tell me how it works. What's in there? They don't ever tell you what's in there and why it works.
They just
you
tell you
need to
bullshit.
know. Yeah, it's probably, and I don't know whether this person's a real actor or whether it's a real
person,
dog owner. Yeah.
Could just be AI.
In that way, because most of the people want to know, why does this work? Now, that's what we're doing today. We're talking about this, and I'm telling this is why this works. This is why that works. This is why this works. If it's magic, that's fine. But this isn't a magic act. This is your clients need to know why this is doing what it's doing. And then and in fact, one time we did a study for Movaflex, and so it was really weird because I got 2 or 3 physical therapists on the study. It only was for like 12 dogs, and they gave the drug away, gave the Movaflex away for 2 months, but the clients had to come in and describe what the dog was doing. Perfect when you have a physical therapist because they're trained to notice these things, and they're trained to do all this stuff. And so that was just like weird luck. So I had these, and they would come in and say, well, now he's doing this. Well, now he's doing that. Now he's doing this. He's doing this and this and this and this. Now he's doing it. You see stuff that happens. I think that's the thing about medicine. I don't think that sometimes we're trained appropriately to make the observations, but you have to worm this out of clients. Yeah, we're doing a heartworm treatment study one time where we used topical moxidectin to treat dogs with heartworms, and I can remember this one dog came in and the woman says, "Hey, listen, there's nothing really wrong with my dog. Are there any positive for heartworms?" And I said, "Okay." I said, "No coughing." Nope, no coughing. No difficult breathing. No exercise intolerance. No, nothing. And I'm kind of obnoxious about the way I'll do stuff sometimes because I'll keep asking. It must be like I'm trying to figure out who murdered somebody or something. But anyway, and then she says, well, I don't know what you don't understand about this, but he's not doing anything. So he's perfectly normal. Okay, we're going to put you on the study. Got doxycycline, got the topical Advantage multi or barrier. That's what we use nowadays. And it's moxidectin and imidaclopramide, which would be Advantage. Now, the Advantage doesn't do anything for this, but the topical moxidectin has a really long half-life, like 36 days. And we understand if we give doxycycline first, that we'll kill all the heartworms. Doing it this way. It's only cost $200 versus $2,000 for the typical
study. A lot more cost effective.
Yeah, and if anybody's listening to this, and I hope somebody listens to this, and you got a heartworm dog and you want to treat it, I'd be more than happy to walk you through this whole thing. It's not too bad.
Call the Voyager. It's called
Moxidoxy treatment. Moxidoxy.
No, I'm saying if they want to get one-on-one advice from you.
Moxidectin plus doxycycline. So it's called Moxidoxy treatment. So anyway, I'm treating this dog, and I got to bring him back in every 30 days and heartworm test him because we're collecting data points and everything and doing all this stuff. A lot of fun doing these studies because you think you know what's going to happen, and it's never exactly the way you think it's going to happen. So it's really kind of, I hate to say it's kind of thrilling, but it can be fairly thrilling watching all this stuff. Oh my God, look what just happened here. So anyway, this woman comes in and she says on about the third visit, and she says, I said, everything all right? Yep, everything's exactly the same as it was. He's normal just like he always was. And so we go back and run the test, and he's still positive. And I come back and I say, oh, he's still positive. It's only been 2 months or whatever it's been. And she says, "All right, but I do have a question." And they said, "What's your question?" She says, "All of a sudden," and this dog, and his name escapes me, or her name escapes me, but she's playing with one of her toys now. Her favorite toy, she hasn't played with that in 2 years. And now all of a sudden she's playing with this one toy. Does it have anything to do with the heart treatment? And I'm like, could be, but I doubt it. I think that's just, maybe she's bored and wants to play with this toy again. And then they come in 30 days and have another heart test run. Okay. So she says, "Well, you remember I told you about the toy thing?" I said, "Yeah, I remember the toy thing." And I said, "Dog's still positive, by the way." And because we ran a blood test, dog's still positive. And she said, "Well, it's the craziest thing about that dog now. He's not only playing with that toy, but he's playing with all his toys. He hadn't done that in a long time."
So maybe the dog wasn't feeling that great.
Bingo.
And it was just the normal.
So here's what we think. And most of everybody that's going to listen to this has got a veterinary degree. If they have a veterinary degree, is going to go ahead and say, "Well, it's because you're killing the heartworms. The dog feels better because you're killing the heartworms. And now his blood's flowing better." Half right. You got 50% of it right. He's doing better. We think that a lot of these dogs are allergic to the feces that the heartworm makes.
Really?
So the heartworm drinks blood and then defecates it out.
So it slowly makes the dog sick.
Well, the dog's actually allergic to that. So it's foreign protein. So it goes in as dog blood. Not allergic to dog blood, but now as it goes through the heartworm, now it's turned into heartworm feces. So it comes out with the signature. The DNA signature would be of.
That's crazy.
It is crazy, but I think it's true. I don't think there's any question it's true. And lots of times when we're looking at these dogs, and we do a CBC, complete blood cell count, the white cells and everything, you see the eosinophils are high.
Yeah.
And I've heard people say it was because of they're allergic to the antigen in the female heartworm's uterus.
What?
Well, yeah. But I said,
That's crazy.
I said, I don't think that's true. I said, I think what it is allergic to the feces that the heartworm is emitting. And that feces, you have to remember, like in a flea allergy dermatitis, the dermatitis is always only where the fleas are feeding. But in this case, the feces goes out and it goes into the kidneys, goes into the liver, goes into the brain. So what happens is they're having a reaction at all those places. And then as those heartworms start to get sick, as they start to get sick, they don't eat as much. Okay? And so not as much feces is being emitted.
Did the dog end up being heartworm negative eventually?
Yeah. It was great. And then he was back to, in fact, a third time the woman came in, she was pissing and moaning about the fact that her husband's stepping on the toys in the middle of the night when he goes to the bathroom and stuff. And so he's mad at the dog for dragging all this crap out in the middle of the bedroom floor. And you know how it is when you walk across the
some of the hard toys, they get you.
A Nylabone, you step on that. You step on that sucker in the middle of the night. Yeah. And next thing you know, you broke a toenail and you're bleeding all over the floor. Anyway,
that hurts.
So we think that's what happened. So we think that when they put him on the moxidectin, and so we sometimes think that they got the disease right and they've got it figured out that there's an allergy thing going on, maybe because the eosinophil counts are high, and you see high eosinophil counts when you have parasitism. But we think it's to the feces, not to the. And so somebody wanted to debate this thing, and I said, it was a veterinarian. I said, "You ever been to a cow watch?" And they said, "Yeah, I've been to a cow watch. I don't know if you know what this is. It's a dairy science project. So you have to go out and watch how long the cow chews or cud, and and then how often
veterinary stuff,
how often they urinate, how often they defecate." And I said, the gutter behind the cow where everything goes, urine and feces. Yeah. I said, is there more urine in the gutter, or is there more feces in the gutter, or is there more antigen to the cow's uterine lining? Well, I've never noticed any of the uterine lining coming out, but I do see feces and urine. I'm like, well, yeah, there's a hell of a lot more of that than there is of the. So you have to know that there's more feces and there's more urine in there. There may be some DNA from the reproductive tract of the cow that's in the gutter, but it's got to be 0.0099%. It's got to be minuscule as hell.
Right.
So most of the common sense part of this thing would be it's to the feces of the heartworm
rather than the heartworm itself.
Exactly. And I'm not even sure if a heartworm urinates and defecates. I think it just defecates and it's all one It's all one gig.
I wonder if we can look it up.
Yeah, we could, but
Do
we wouldn't want
heartworms.
to make me look stupid, would we?
I'm curious now.
Yeah, but those are things that I think this is really the fun part of veterinary medicine when you get to figure these things out, and that's and what you have to do. And we didn't figure this out right away. This was like we were into this. We did a pilot study, then we did a pivotal study on this topical heartworm treatment for dogs. And quite frankly, we think, and there's a number of people that think this. There's a number of people that have rescues that do that, and they actually get to see dogs to get the arsenic versus the topical moxidectin.
Yeah.
And they'll tell you the topical moxidectin is easier on their dog than the arsenic ever was. And,
Really?
And the arsenic's $2,000 and the other stuff $200. So it's one of those things where the cost is inversely proportional with the, actually is actually probably what I'd refer to as directly proportional to the number of side effects. I think you have a lot more side effects with the expensive treatment of arsenic and stuff.
Oh, I believe it. It says it's unknown.
What?
It says it's unknown.
Unknown.
I don't know. I didn't know that they were transmitted by mosquitoes.
Yeah. Yep.
That's wild.
Yep. They actually have to be in the mosquito for 6 or 7 days at 70 or 80 degree temperatures for capacitation to occur, I guess. So maybe what they call it. I don't know. But anyways, there's a molt that kind of occurs in the mosquito. So the mosquitoes, so that mosquito bites like in Michigan here, probably you'd have a mosquito bite a coyote and then go next door or float a few 100 yards down the street and bite the French poodle in the yard. And
that's how it's transferred?
7 days later, you dig a hole. And then actually as a mosquito pulls its proboscis out, the thing is...
The hook.
Yeah. So there's... So some of the microfilariae come out of the mosquito then and then go back in the hole that the mosquito makes. So you don't usually give... sometimes people think there must be 100 or 50 heartworms transmitted in that bite, and it's just one or two.
So what happens when a mosquito bites us? We don't ever...
Oh, we're not a natural. We're not we don't finish.
We don't carry it.
We don't kiss you. Yeah, we don't finish that life cycle.
Oh.
Cats will finish it, but they only hardly ever get 1 or 2 heartworms instead of 50 or 60. And it's a problem with a cat because when the cat has that heartworm die and go to the lung field, there's a hell of a reaction. Some of those cats will die.
Oh.
But you have to identify. You can identify those cats as sometimes they're coughing cats.
That's wild.
Yeah, and then usually what you do is you try to put them on prednisone every other day or something like that, so that when the mosquito does, or when the heartworm does go into the lung field, you hope that there's not this nuclear reaction that occurs in the lung field when that because that mosquito or that heartworm dies and it starts to like do the roadkill thing.
Yeah.
So it starts to come apart.
Wow. Okay, back to nutraceuticals.
Okay.
We got on a little tangent. Well, not really, but all related. But obviously, nutraceuticals are more like of a holistic approach.
Yep.
Do you feel like in the past 20 years in veterinary medicine that there's been a huge shift to holistic approaches versus...
Yep. The best approach is to do traditional and holistic together. So you put them together. You make a cake, you put frosting on it.
Real drugs for real bugs, but also...
Yes, real drugs for real bugs, but I think the best thing, but I actually am telling you that I think, you can try some of these things without any traditional drugs and get by with it. And it works pretty good sometimes. And I've been encouraged by that. And a lot of people are into this, Chinese medicine thing. And I think there's a lot of it that has some benefits. I'm not completely sold on everything here,
but it's
in our business, the liver business, the problem we have in veterinary medicine right now is the game plan or the playbook for liver disease is you establish they have liver disease and you give them denamarin or milk thistle and SAMI, and that's what denamarin is, SAMI and milk thistle. There's all sorts of forms of it, and it's a protectant. Does it make anything better? Nope. Doesn't make anything better, but it protects your liver while it may be fixing itself. But if you're not given if you got copper in there and you're not doing anything about the copper, you can give denamarin until the cows come home.
Okay.
The dog will have a lot of denamarin in when you bury him, and that's not what we should do. We should be able to figure these things out, and if people don't have the money to biopsy them, that's actually the big controversy in our business right now. It's too
expensive.
Well, it's too expensive. Well, it's too expensive for a lot of people.
I wouldn't have 2K to put down on a biopsy.
Well, it's not 2K, it's 4 to 5. And the worst thing is that
I thought it was 2K.
no. Well, sometimes if we do it surgically, so we just make an incision. Most dogs get referred to a
Specialist.
Where
it's way more expensive.
Well, they use a laparoscope. They do it a different way.
Yeah,
but there isn't any reason you just can't, lay a dog down, anesthetize him, and
do it real quick.
Well, like you're going to go ahead and do a spay, except you put the incision on the other side of the umbilicus. You put it cranial to the umbilicus as opposed to posterior to the umbilicus. So you make your incision, go get a couple of pieces of liver, send them in, and find out what the hell you got going on. It's pretty simple. We talk about this disease. There's 3 things to do when you get this disease, and biopsy, the 3 things you do: biopsy, and biopsy.
Exactly.
And but the real question is, can you actually treat them with a chelating agent without diagnosing it? My personal opinion is yes, you can do that. The purists,
you need a diagnosis.
Yeah, some of the people I work with think, oh, you can't do that. You can't do that, and I'm like,
maybe that's like new veterinary medicine.
Yeah,
era.
well, most people don't want to fly by the seat of their pants, and but sometimes that's the only choice you have is to fly by the seat of your pants, and so
especially if you can't afford.
Yeah, and you put them on a chelating agent for 30, 45, 60 days, and if the liver enzymes come down, you'll know what's going on. That's kind of the way we figure it out now. With sometimes if we have a dog with elevated liver enzymes, we just change the food and it'll come down. So that's one way you can do it. But a normal ALT would be up to about 125, and if somebody walks in with an ALT of 900. So you got a hell of a thing going on. You probably don't have 30 or 45 or 60 days to figure it out. You got to figure it out fairly soon. Yeah.
That makes sense.
Yeah. So,
go ahead.
Well, the nutraceutical thing is it's kind of a lot of fun. Clients come and say, "What do you think of this? What do you think of that?" And some of the things that work are when you put 2 or 3 things together nutraceutically, and you do it that way.
Run with that.
Yeah, run with that. And
what about oversupplementing? Can that ever harm a dog's health?
Not really.
I'm sure you know somebody that comes in and they're like, I give this and this and this and this and this and this and this in a topper.
Yeah, it's probably too complicated problem for me. I do have one thing. We were talking about this at work the other day. I had I don't do it much anymore, but I used to play basketball on Sunday mornings over at a school like 15, 20 miles from here. And it got around when we were playing that I was a veterinarian. And so one of these guys came up to me and afterwards and says, "Hey, listen, I got my little dog. And when he got to be 8 years of age, he started to have 1 or 2 seizures a month.
Mm-hmm.
And then you got to having more and more and more and more." And I said, "What kind of dog you got?" He said, "A Schnauzer." And I said, "Oh, I bet I know what's going on here." I said, "Some of these dogs get what they call hyperlipidemia. They have a hard time getting rid of the fat in their diet.
Mm-hmm.
So they have what they call tomato soup blood. In other words, there's so much lipids in the blood that it looks like tomato soup when you shake it up." And I said, "I'm not your veterinarian." I said, "But what I would do, here's what my suggestion would. Well, my suggestion would be, if you want, go see your veterinarian and get a chemistry profile run and see if this dog has high triglycerides." And he says, "Well, if I don't do that, what should I do?" I said, "Go get yourself a dog food that has 9 or 10% fat and not 16 or 17 like you're feeding right now," because he told me he was feeding. So he went out and got the 9% fat diet. He comes back, and you'd have to know, when we play basketball, sometimes we're not very
nice.
Yeah, we're not very nice with each other. So
I know. I've seen
this guy and I would play each other and just beat the crap out of each other, and then we'd discuss his dog when we got done. Anyway, he says
over beers at the Moonraker.
A week later, he comes in. He says, "It's really weird. I think my dog feels better, and he hadn't had a seizure since I did this." And so this is always fun for me too. And then he goes, and 2 weeks later he says, "Yeah, my dog's kind of running around, feels better. This is coincidental, right?" And I said, "Could be, could not be." And then it continued to play. We played right through the summer and everything. And 6 months later, he says, "My dog hadn't had a single seizure since I quit feeding his foods with a lot of fat in it."
That's wild.
Well, yeah, you got rid of the triglycerides. And I said, "Your dog was capable of doing so much, and you were and you were feeding him food that made too much for him to do.
Yeah.
Hyperlipidemia. We see that all the time. You pull the blood up and there's red cells down here, and then in the middle there's this great big buffy coat that's got all this.
Oof.
This is after it's spun down with all this fat in it and stuff. We actually even see dogs. I haven't seen one of these in a long time that actually gets fat in their cornea.
Oh yeah.
So they walk in and they got all this kind of a blue eye and stuff, and then you put them on a low fat and you check the blood work, and the triglycerides are like greater than 500 or whatever they are.
Yeah.
So you put them on an ultra low fat, and that's kind of cool because the client tells you, like 3 days later it got better.
We should come up with a low fat diet.
Cleared up. Well,
a lot of pancreatitis dogs too.
Yeah, a lot of pancreatitis dogs, and so.
But would that be a different diet than just the low fat diet?
No, it'd be the low fat diet. That'd be the low fat diet, and in this case where you have hyperlipidemia, you don't need to be. And I told this guy that listen, you don't need to be on a low fat diet. You need to be on an ultra low fat diet. So we eventually moved his dog into a diet that only had 5% fat in it.
Isn't that what it is for pancreatitis dogs?
Yeah,
5 to 10. Yeah.
Yeah, ultra low fat diet. Ultra low fat. There's two of them. Science Diet makes one, and Royal Canin makes one.
Mm-hmm.
Is that right?
Yeah, I think so.
Yeah. You get an ultra low fat diet. No. Science Diet makes one, and Purina makes one.
Okay.
They make a dog food called EN, ultra low fat. So you put that, and there's another condition, lymphangiectasia. I think our friend Alex has one of those. And that dog, in fact, the guy downstairs has one that has lymphangiectasia in this building. And so he's on an ultra low fat diet. Yeah. Got all sorts of dog food laying around down here, and he can't feed any of it to his dog. But
poor guy.
It really works good.
Yeah.
And I'm happy for the people it does work good for. But you have to, and what you have to do as veterinarians, you have to have experience and do this. Wow, this works really well. And that's the other thing. It's like, I'm talking about the lesion in the corneas and stuff. Well, you don't see that very often. But once you see it, and then you can put the two together, these are like Chinese handcuffs. You got to put them together. You got to put that eye lesion with the high lipids, high triglycerides in the blood.
Figure it out.
And you figure it out, and then you just say, this could, and like with the seizure stuff we were talking about, most of those conditions are what they call idiopathic epilepsy, which means they just have seizures because they're genetically inclined to have them. But there can be other things that are going on. And in that dog, he quit having seizures altogether once we go.
That's awesome.
I'm sure he's left the earth now, but I'll bet he didn't have seizures up until the time he died of old age. But that, and these guys that I played basketball with, they were always kind of funny because they said, it's really hard for us to believe. And I'm like, no, what's hard for you guys to believe? And he said that you're involved in the art of healing. And because
you're an asshole when you play basketball.
Yeah, we go out and beat the hell out of each other. That's right. He says, it's hard to believe you're involved in the art of healing. But anyway.
You played basketball with a cop one time that pulled me over, and he was like, "Does your dad Pete?" Yeah. And I was like, "Yeah." And I was thinking like, "Oh, he's probably saved his dog or something." He goes,
I'll bet this cost you $120.
Yeah, I did get a ticket. He was like, "Your dad beat the living shit out of me in basketball." I was like,
"Sorry.
Not getting out of this ticket."
Nope.
But it was okay.
Yep.
Anything else you want to wrap up with nutraceuticals?
No, but I think this is a good thing to, you know what, and for people who are listening to this, here's the thing. Make your observations and ask questions, and usually between the veterinarian and the pet and the owner, you can kind of figure it out.
Yep.
But not always with nutraceuticals, but frequently with nutraceuticals. Yep.
All right, let's get some outro music going. We sure appreciate you guys listening along with us today. We hope that we've been able to share some information that will help you love your animals just as much as they love you. Don't forget, always treat the treatable, prevent the preventable, and we will catch you on the next one. And don't forget, if you have any questions or topic suggestions that you'd like, please submit them to us on Instagram at Voyager Dog Food Co.
Amen.
Amen.